Hi, I'm Karen, and I would like to talk with you about cause and effect. As we consider the relationship between cause and effect, we will look for the way one event causes another event. We will also imagine how our 24-year-old friend, Andriana, will be able to use these skills in a job as a CNA at AdultEdMed. When Andriana met with her teacher, they went to ONET to learn what she could expect from working in a job as a certified nurse's assistant. ONET identifies the following important tasks for people who do things that a CNA would do. Maintain records of patient care, condition, progress, or problems to report and discuss observations with supervisor or case manager. ONET clearly identifies the skill of critical thinking as a key skill for individuals working in home health care, and this is what is considered critical thinking. Using logic and reasoning to identify the strengths and weaknesses of alternative solutions, conclusions, or approaches to problems. As we go through our lesson today, think about how learning about cause and effect could be useful to someone like Andriana. Now let's start by taking a look at 3 questions and thinking about the answers. 1, what happens when you drop a glass onto a tile floor? 2, what happens when you lower the number of calories you eat and start to exercise? And 3, what happens to a snowman when the sun comes out and the temperature rises above freezing? Now, as you consider the response of what happened in each of these questions, you are using your imagination to complete cause and effect scenarios. The questions suggest a cause, and you essentially come up with an effect. The cause, the glass falling to the floor, had the effect of glass shattering. The cause, lowering caloric intake and exercising, had the effect of weight loss. The cause, the temperature rising above freezing, had the effect of the snowman melting. Very simply, cause and effect is how one event causes another. And today we'll talk about why it's important to understand how to identify the parts of this analytical strategy. We'll also see how knowing this pattern for organizing your thoughts will benefit Andriana in her pursuit of a CNA job at AdultEdMed. Perhaps we should take a close look at how to think about cause and effect. First of all, the cause is why something happens. Typically, the cause is the first step in the process of what happens. You can also view this as the reason for something happening. I would like to make the point here that the cause always comes before the effect, chronologically speaking, but it may not be the first thing mentioned or noticed. Keep that thought close by for later. The effect is what actually happened or the result. The effect always comes after the cause. Keep in mind that the mention of the effect may come before the mention of the cause. I know this sounds like a mysterious riddle, so maybe I should explain. In the questions we looked at earlier, we looked at things in order. The glass dropping to the floor was the cause of the effect of the glass shattering. Lowering your number of calories and exercising was the cause of the effect of losing weight. The snowman in temperatures above freezing was the cause of the effect of the snowman melting. We identified the first step in the process, the cause, the why, for the eventual next step, like the glass falling on the floor. Then you came up with the effect, or the result of what actually happened. Now, let's identify the cause and effect of the following statement. I left the party early because I began to feel sick. What was the cause in this situation? If you're thinking feeling sick, you're correct. The cause is feeling sick. and the effect is, I left the party early. The statement, however, mentions the effect before the cause. Because the components of the cause and effect relationship are not always stated in order, it's good to ask why something happened when you want to know the cause and what actually happened to identify the effect. Check out this graphic as a visual picture of what I'm saying. Notice that no matter what order the components were mentioned, the placement for what and why is consistent on the chart. When looking for the cause, watch for words or phrases like why, because, for this reason. You'll be able to identify the effect with these words or phrases. So, therefore, consequently, as a result. Andriana will surely need to sharpen her skills of sorting through and examining the cause and effect of many things during her busy day. Noticing details and helping to conclude why something happened will be particularly important for her patients, her supervisor, and for the families that she will be supporting. Observing what has happened, seeing the effect, and then discovering why something happened, discovering the cause, will be extremely important skills. Together, let's see if we can discover the cause and effect of a sample scenario and see how Andriana can put this information to practical use. Pay close attention to how her discovery leads to a conclusion and further action. Here's the scenario to consider. Bess Taylor was an 88-year-old woman who was always pleasant to be around. She and Andriana enjoyed each other's company. Upon arrival to care for Mrs. Taylor, Andriana noticed that her patient seemed confused and verbally critical and angry. Andriana noted this in her report to her supervisor, after which some medical tests were done. It was discovered that Mrs. Taylor had a urinary tract infection, a UTI, which caused her to behave differently than normal. What were the cause and effect in this situation? Mrs. Taylor's cheery disposition abruptly changed, and Andriana sees this as the effect. But what was the cause of this drastic change? If you're thinking it was caused by her UTI, you would be correct. Andriana noticed the effect, which led to diagnostic tests that eventually discovered the cause. A CNA needs to be keen and to look and listen to patients to properly assess their conditions. In many cases, the CNA can be the first to notice clues to start the diagnostic process. In this scenario, Andriana was able to listen and observe in order to discover that Mrs. Taylor was not behaving as she had before. This indicated that a nurse or doctor needed to be called in and alerted. Of course, Mrs. Taylor was then able to get proper medical treatment and get her back to good health, not to mention back to her cheerful disposition. Sorting through the cause and effect issues of life aren't just things that you need to know for passing a science or social studies test to obtain a certificate of high school equivalency. Understanding how to look for and identify the components of cause and effect is a job skill that can have a life-saving impact. This is information you will need as a life skill for yourself and to get things done on the job. I think you've got this.